We will continue with the third lecture about dog and cat dietetics. For your overview to the third field of clinical nutrition, namely the dietary management of the clinical diseases. Just at the beginning, I have to tell you that this subunit is not in direct exam question group, but maybe of the highest clinical relevance. And these are the gastrointestinal tract. Our logic will be the following. We will deal all the problems of the gastrointestinal tract from the mouth through the stomach, small and large intestine. After that, we will see the problems, the organs related to the gastrointestinal tract, like the pancreas, like the liver, and the other organs. After that, the heart and the kidney, and so on. So first the gastrointestinal troubles, starting by the mouth, is the vomiting, which is something problematic with the dog and cat, especially with the dogs, because in the etiology you can know from your own experiences that the dogs have a highly developed vomiting center. They can vomit even at will. This is the trophallaxis. I cite the first lecture about the evolution of the digestive tract. The emotion, the excitement, and the so-called vestibular disease. This is a excitement of the vestibular organ after and during traveling in car may cause vomiting, but also visceral inflammation, toxemic states, and some medicines can cause vomiting. The acute gastritis and exocrin pancreatic insufficiency may also result in vomiting. The treatment should be first to correct fluid and electrolyte losses by a Ringer solution given by IV or in case intraperitoneal, and in case of necessity anti-emetic substances, anti-emetic chemical compound like metoclopramide containing medicines should be given. The etiology of the vomiting is very variant, and for that reason it is very important to see the differential diagnosis, because it will show us that not only problems of the digestive tract are involved. The first what we have to make a difference that this is a vomiting or regurgitation. If this is a regurgitation, by using radiography we have to make a difference between mega esophagus or a obstruction by tumor or foreign body. If it's a vomiting, you have to see that it is a hematemesis, blood in the content, or no hematemesis. In the later case, we once more need radiography, many times using also contrast and also ultrasound, together with the whole chemical panel to see the differences. For the hematemesis, we have also different possibilities: coagulopathy, trauma, and ulcer. And I draw your attention to the right corner, where you can find the extra gastrointestinal diseases causing vomiting, and these are the renal diseases: renal failure with uremia, the hepatic diseases, heartworm disease, diabetic ketoacidosis, hypercalcemia, and any forms of peritonitis, hyperthyroidism, especially in cats, pyometra, and other causes can contribute in the vomiting. The next organ from the mouth and the esophagus is the stomach, and the related problem is the gastric dilatation and volvulus, the GDV. The etiology of the GDV is excitement after feeding, or exercise after feeding, especially if the diet is cereal and leguminous based, which will produce gases. Gases can come to the stomach by aerophagia, the swallowing of the air also. And anatomically, the Great Danes and similar breeds had a breed disposition. The prophylaxis of the gastric dilatation and volvulus is very simple. Avoid exercise prior and following the feeding. Divide the daily ration into 3 meals. Why you have to emphasize? This is a typical human rationing. Yes, but for an adult dog, you have heard during the healthy dog and cat, it's enough to give once meal a day. But by socialization and by making dog friend, we can feed them 2 times, but in this case at least 3 times. Please prefer the use of the moist meat-based diet of high energy density. It will not produce gases. I have to tell you that many producer tells us that there is no real differences between moist and dry pet food. I have to tell you that in some special health status or disease status, there is a problem. For example, the gastric dilatation and volvulus, or in case of some urinary bladder stones, and the physical solution that put the feeder or use a high feeder which will prevent the aerophagia. And now we will see in the next how important is the feces consistency, how important not only on this joke, but also in the real clinical everyday life, from dog, cat up to the human. And for that they use the feces consistency, which is a number which will reflect the dry matter content or water content of the feces, and the physical form, which is derived of course from the water content and also other characteristics. I will show you the most important scoring systems, namely the first will be the Waltham feces scoring system, which start with the dry up to the watery, and you see here in the up and left corner the grade 1, which is a so-called bullet-like, crumbles with little pressure. Okay, this is a constipation or obstipation. The grade 1.5 can be found up and right. This is the hard and dry, and the stool or feces cracks when pressed. This is also a constipation. Constipation is the grade 2, which is on the left lower corner. This is well formed, does not leave a mark when picked up. And we arrive to the optimum grade, the grade 2.5 at the lower right corner. This is well formed with slightly moist surface, leaves a mark when picked up. And in the slight and severe diarrhea will follow. With the left upper corner, the grade 3 is moist, beginning to lose form, leaving a definite mark when picked up. But this is not a sick animal, maybe a overfeeding result in a grade 3. Right upper corner is the grade 3.5, which is very moist, still with some definite form, starting diarrhea. Left lower corner is the grade 4. Most of all form is lost, no real shape. This is a diarrhea. And right lower corner, this is grade 4.5, liquid stool with slight consistency, and in the middle you have the grade 5, entire liquid watery feces. This is many times bloody and related to some parvoviral infection. Other systems are a little bit different. For example, the Royal Canin fecal scoring system for cats, but similar for the dog, has a little bit different scoring system. They are starting with the score or grade 1, which is the liquid watery feces, and through the more and more consistent they will arrive to grade 6, small very hard fecal pellets. So this is from 1 to 6 and the opposite direction. The Purina fecal scoring chart is similar to the Waltham, but starting similarly with 1 and very hard, but going up to 7 being the watery. And in this case, of course, that the good quality may be the between 3 and 4. And the human Bristol scale, it is similar to the Purina, or the Purina is similar to the human Bristol stool scale, which begins with 1, severe constipation, up to 7, which is a severe diarrhea. And now we will see the two extreme. First, we will see according to the Waltham feces consistency scoring from 3 to 5, the different types of diarrhea will be shown. The diarrhea is a clinical manifestation of an intestinal disturbance which will result in an increased volume or fluid content of the feces. The classification of the diarrhea may be, according to etiology, osmotic, increased permeability of the intestinal wall, secretory, and change of the motility. The most common etiology are the dietary indiscretion, such as overfeeding, consumption of soiled feeds, or sudden dietary change. It is very interesting, the enzyme deficiency related diarrhea. More than 6 gram per kilogram live weight saccharose or sucrose cannot be splitted and digested in dog and will cause osmotic diarrhea. Or 1 gram per kilogram live weight lactose in cat is the tolerance level. It is not a great amount of milk, maybe a deciliter per cat per day. Above that, the lactose also will cause osmotic diarrhea. Here you can see a clinical picture about a chronic diarrhea, diuretic dog. This is especially from exocrin pancreatic insufficiency, so this picture will come back once more, but here it's only an illustration how the etiologies are linked to each other. Okay, so how we can treat the diarrhea generally? We have to use a dietary rest at least 1 or 2 days. Recently is disputable. And why? Because there is a delicate balance between the goodness of the dietary rest, nothing to feed, nothing to fed, or the problem with the atrophy of the villi, which are progressive with the dietary rest. Every time in the following I will give 2 characteristics of the diet. In this case, low fat, low fiber diet, and after that you can find the producer and the trademark on the market. You have to find low fat, low fiber diet. It can be made from chicken, fish, meat. We can use in a homemade diet cooked egg or cottage cheese with boiled rice or boiled potatoes. The diet should be offered in small, frequent meals. In case of dehydration, electrolytes, IV, IP, or even peros can be used. For example, the human normalit powder is very appropriate. With one precaution, it should be diluted less concentrated than the human proposal. Double dilution is proposed for dog and cat. We have to avoid the milk and the raw eggs. It is extremely interesting that the raw eggs and the raw liver can cause diarrhea, and the hard-boiled egg and the cooked liver can cause constipation. As an adjuvant, we can use Reasec or Imodium or other similar human medicines. Dietary treatment using veterinary diets. You can use, for example, many other producer, but this is one of the best, gastrointestinal biome. This is a Hill's prescription diet in dry, and is available in different form to treat the diarrhea. The malabsorption can be found in this slide. This is a picture of the feces on your left with native oil droplets, and right you can see the consequence of the malabsorption, a very thin, just emaciated dog. In the malabsorption, we can see in the clinical findings lymphotic plasmacytic enteritis or eosinophil enteritis with villus atrophy, or the same effect may have the lymphosarcoma and the above mentioned exocrin pancreatic deficiencies. So you can see that the malabsorption is a collection of different etiology, but the symptoms and the treatment can be similar. We can use prednisolone plus as a steroid treatment, dipancrin to replace the pancreatic exocrin pancreatic enzymes, and for the dietary treatment, low fat, low fiber diet based on highly digestible carbohydrate rich energy source like rice and potato. We have to increase the levels, the supplementation of vitamin K, especially at cats, because of the loss of vitamins through the feces. We also have to mention the coprophagy, which is not a serious disease, but a social problem. This is most commonly occurs in dogs than in cats. The etiology may be a pica. It means that a bad habit. Pica means that eating what is not a feed. This is a bad habit, or maybe controlled or stimulated by a deficiency in some nutrient or vitamin or mineral, and also can be found in exocrine pancreatic insufficiency. It is not uncommon for a dog that they eat herbivorous feces, rabbit, sheep, or horse feces, if they have a fiber deficiency. But eating human or another dog's feces, it's dangerous epidemiologically. Generally, this is a bad form of trophallaxis. This is atavistic to the dog. During the domestication, many thousand years, they were fed on the residue of the human tribe, the bones and the byproduct of the food, and maybe even the feces. The fiber level is discussed. Some experienced that the higher fiber level will prevent the coprophagy. The other told that the opposite. So we have to make both. First, we have to try a higher fiber level, and this is not effective. The opposite. We move on the other extreme of the feces consistency scoring, namely the hard feces consistency score 1 and 2. And this is the case of the constipation or obstipation, which means a severe form of the constipation. The constipation is an inability to pass or a difficulty in passing feces, a consequent retention of fecal material in the rectum and colon. A very frequent etiology if the animal are eating too much bone or hair and fur or feather intake in case of cat as a prey animal, mice or sparrow. But too much bone, more than 16 gram per body weight, may cause constipation itself, or an inflammation of the paraproctal gland close to the anus may cause pain during defecation, and it will prevent the animal to try it. This is the pain of the paraproctal gland. A tumor can have a similar role, or neurological problems, problems of the innervation of the defecation. Some drugs and lack of exercise can cause constipation. The treatment: first we have to remove the first some centimeter of the dried feces. After, we have to prescribe exercise, physical activity, and the fiber in the feed mixture should be higher than 10%. For that, we have a high fiber diet in the market. And the acute and chronic colitis has multiple etiology. Not going into the details, I only have to mention the dietary sensitivity as a important etiological factor. We have to concentrate on the treatment and control. First of all, we have to remove the underlying causes. Second, sulfonamide therapy turned to be very beneficial. For example, sulfasalazine therapy sometimes is better than the antibiotic therapy. As a dietary treatment, we use highly digestible, low-fat diet, less than 6% of the diet in acute cases. This is a very low-fat diet if you compare to a normal, healthy dog pet food with at least 20% of crude fat. In chronic cases, we have to avoid cereal-based diet, and we use high-fiber diet when the concentration of the diet is higher than 10% of the dry matter. And we arrive to the flatulence, which is not a disease. This is a common antisocial problem. Everybody of us who live together with a dog or a cat can give a tale about it. but the causes, the etiology, mostly the non-starch carbohydrate. For example, the stachys, which is, for example, in the soybean. And the soybean is a very good protein source and component of the little bit cheaper pet food. And this cannot be, non-starch carbohydrates cannot be splitted, break down by the amylase enzyme activity, and it will undergo a bacterial fermentation in the large intestine, in the colon. And the end product of this fermentation are, among others, are the gases, methane and CO2, etc. The protein overfeeding also go through bacterial fermentation, because the amount of enzymes, the enzyme activity in the stomach and the small intestine is not enough to break all the protein down. And the fermentation will also produce the gas product, the raw material for the flatulence. The prophylaxis and the control is include also the reduce of the aerophagia, because it can contribute to the development of the flatulence. See the details at the gastric dilatation and volvulus. We have to avoid, therefore, the soybean and other legume-based diets. The incompletely cooked potato with a high starch level, the same effect, because the amylase activity of the dog is limited, better than in the cat, but in the dog is limited. We have to avoid the cereal-based diet, the brassicas or cruciferae, like the cabbage. We have to avoid the milk. We have to think about the lactose, and also the red meat, like the cattle meat. And by that, and we arrived to the second part of the dietary management of clinical diseases, the organs. The organs, because we finished the gastrointestinal tract from the mouth up to the anus, and now we'll continue the pancreas, the liver, the kidney, the heart, and a functional problem of the whole metabolism, the urinary stones, the urolithiasis. And the first exam question related topic are the dietetics of pancreatic diseases of dog and cat. And for your memory, you can see the picture of the right and left lobe of the pancreas, which can be found beside the duodenum, and between the duodenum and stomach. We have to overview the role of pancreas. We can classify the exocrine pancreas and the endocrine pancreatic functions. First, we concentrate to the exocrine pancreatic functions. Later on, we will arrive to the endocrine functions. The exocrine pancreas makes the synthesis and secretion of digestive enzymes, which has a key role in normal digestion of nutrients. Secretion of bicarbonates and intrinsic factor as well as the co-lipase are important in the digestive functions. For that, you see that we have the acinar cells and the duct cells system. This duct cell system will open in the duodenum. The acinar cells are synthesizing the digestive enzymes, the amylase for carbohydrate, the lipase for fat, and trypsin for protein digestion. Acinar cells are producing the inactive proenzyme and zymogenes like trypsinogen, proelastase, and phospholipase. And the duct cells are producing the bicarbonate as a buffer for gastric acid. This is the reason that in the duodenum the pH will go up to approximately 6 from the gastric tube. Other intrinsic factors are necessary for the cobalamin absorption and for the cobalt absorption, for the vitamin B12, and the co-lipase is a cofactor for the pancreatic lipase activity. And here you can see an overview of the digestive enzymes of the pancreas with the list of enzymes, substrate, and the end product, what I have mentioned. And also you can see an illustration of the function of the pancreatic enzymes and the end product which are absorbed. And after this introduction to the pancreas exocrine function, we move to the pancreatic diseases. The acute pancreatitis is more common in dogs than in cats. This syndrome, this disease has multiple etiology, for example, genetic, viral, toxic, etc. We have to concentrate on the dietary treatment, and the classical treatment of the acute pancreatitis is that nothing per oral, including water, some days, 3-5 days. Nowadays it is discussed first, why was this classical approach? This classical approach was that everything which touch the first part of the small intestine, it is a feedback and stimulation to the pancreas for a higher synthesis metabolism, which is very dangerous in inflammation. Nowadays it is discussed, but 3-5 days it's too long, so maybe a sonde feeding can be the solution in this case, but this is a clinical situation. Which type of feed is used after this some days, which is absolutely important, that the low-fat diet, because the fat content is also a stimulation, a feedback for the pancreas. And we have to divide the meal into the daily ration into minimum 3, but preferably in 5 small meals. And the next exocrine problem is the exocrine pancreatic insufficiency. The EPI we've mentioned in relation with some other state. The etiology is congenital in dogs and mice, and rare, very rare in cats. The dietary treatment, because I like to concentrate your attention to the most important, which is the most important, and after we can go into the details. So highly digestible, low fat, low fiber diet. This is the dietary treatment with enzyme replacer. In Hungary we have a trademark D-pancreas. Okay, and here you can see the well-known picture of the leading symptom, diarrhea, derived from EPI. And here you can see that sometimes this is abdominal pain to the dog, and you can see a dog in exocrine pancreatic insufficiency. This disease has an etiology that will cause chronic necrotic or atrophic damage of the pancreas, and this can be viral, autoimmune, as you have heard. The production of digestive enzymes will decrease, or there is a obstruction of the pancreatic duct, and both can lead to a complex digestive disorder, and the lack of enzymes lead to maldigestion and malabsorption. The maldigestion means that the feed compounds cannot be properly broken down within the intestinal lumen, and the second step, that there is a malabsorption, that the nutrients fail to pass from the intestinal lumen into the blood or the lymph. Here you can see a list of the etiology and the pathogenesis of the EPI. Here you can see on the left acinar cell atrophy, and also a fail of the production of enzymes, only 10% of the normal production, and we have to mention also that obstruction of pancreatic duct caused, for example, by tumor can occur. We have also a breed disposition, German Shepherd, some collies with autosomal recessive disorder. The clinical signs of the EPI are loss of the body weight despite of more and more feed intake and higher appetite. The ingested feed is osmotically active, which will cause water influx and a chronic diarrhea. In the up corner you can see a result of this process. The ingested digesta in the intestine will undergo to bacterial fermentation, will cause bacterial enteritis and flatulence. Coprophagy and vomitis can develop. With the chronic diarrhea, the vitamin deficiencies will conclude in skin and fur problems, the deficiency of different vitamin B, increased hair loss, and a mild anemia. The abnormal feces shows ingested fat are visible, light pale color, voluminous in amount, and as a secondary consequences, the diabetes and small bowel disease can develop. For the laboratory test, we have different tools. We have the trypsin-like immunoactivity in the serum. We have a fecal elastase test, and we can check the ingested particles in the fecal samples. Are they digested or are not digested, indigestible? Muscle can be seen by GIMSA staining. By Lugol, we can see the indigested starch, and by Sudan staining the lipid droplets. These are the laboratory diagnosis, and we have to arrive to the treatment. Generally, low-fat, low-fiber diet with a high biological value, and supplementation with pancreatic enzymes like dipancreas. But you can also give fresh bovine pancreas with every meal if you can have availability. The vitamin supplementation, you can give cobalamin B12 parenteral, zinc and vitamin K supplementation. Here you can see the enzyme substituent, the dipancreas intestinosolvent capsule with all the components and dosage. Considerations of the diet. Why? Low-fat diet because fat would stimulate the pancreas. Be careful because fat-soluble vitamins or polyunsaturated fatty acid deficiency may occur with a low-fat diet. Low in insoluble and non-fermentable fiber diet because some fiber interfere with enzyme activity. Moderate protein concentration but high in biological value, and increased feeding interval to decrease the insulin peaks, the stimulation of the pancreatic activity both in endocrine and exocrine. The prognosis of the epi, after all, is good, and you can keep the animal free of symptoms. But of course, this is expensive. Thank you very much for your attention, and we will continue with the diseases, dietary treatment of organ diseases.